Okay, good morning everyone. Can you hear me at the back? Yes? Yes, can you hear me at the back? Okay, thank you. So I don't need to hold this to my mouth anymore and talk for you to listen. Alright, so I think I need to tell myself welcome back because you've always been sitting here since the time I left. But welcome to lecture 41 of BMS 300. Today we're going to start with the respiratory system, and everything I discussed today won't be on the exam, right? But thank you for showing up regardless. Before we get started, I have a poll everywhere question for you to help me plan ahead for the exam 4, right? So what would you guys prefer the format to be like? Would you want me to keep it as it is with 34 multiple choice questions and 15 fill in the blank questions, or would you want me to get rid of the fill in the blanks and have only multiple choice questions? Depending on what the majority wants, we can go with that. Because remember, the final exam will be only multiple choice questions. So if you would prefer to switch to that format for exam 4, I want to give you an opportunity to express your opinion. Is this question clear? Should we keep the fill in the blanks or get rid of the fill in the blanks? If you want me to get rid of the fill in the blanks, choose B. If you like things the way they are, choose A. Okay, we got 60 responses, getting more. Okay, most of you said keep it as it is. All right, we will let's see what the other section has to say. And I know a lot of you aren't present here, so I can run it once tomorrow as well. So anyway, before we get into the details of the respiratory system, I'd like to begin with this overview slide on how everything is integrated. And the purpose of what I'm going to discuss now is for you to just understand that whatever we discussed in units 1, 2, and 3, they are going to play some role in how the respiratory system functions, right? So that's the take-home message of what I'm going to explain in this slide. So let me give you a few examples, right? So when we started unit 1, we talked about the structure and the properties of water. And when we talk about the respiratory system, we will see how one of those properties which we discussed of water, such as surface tension, will play an important role here. And then in unit 1, we saw what was the generic structure of cells and their functions. Here we look at different types of cells and how they all have unique functions. The major cell we'll consider are the type 1 pneumocytes, which are really thin cells. They help in gas exchange. And a second type of cell is type 2 pneumocytes, which will produce surfactants, and it is that surfactant which will help reduce the surface tension in the alveoli of the lungs. As far as the cell junctions are concerned, we won't get into much details about that, but we will cover all of the 4 different types of tissues. We will in great detail go over what are the various epithelial cells which are found as you go along the respiratory tract, starting from the nasal cavity down to the alveoli. And we'll see that there are different types of connective tissue we'll encounter. You will find the areolar connective tissue supporting the epithelia. We'll encounter cartilage, we'll encounter bones, and we'll see that there are some muscles which are associated with the bones which we encounter in the rib cage. And finally, there will also be neural innervation, which will control how respiration rate happens, both in a voluntary manner and in an involuntary manner. So we see even there is one aspect of the integumentary system which will play a role in the respiratory function, and what I'm referring to is the one appendage, which is the nose hair, right? So hair is an appendage of the integumentary system, and we'll see what the function of nose hair is. And then we see that the skeletal system plays a role in respiratory function, especially when you consider the rib cage, right? The rib cage is made up of bones. This is going to both protect the lungs, and it can also help change the shape of the rib cage based on the muscle action. And then the endocrine system is something which we will not see how it influences the respiratory function this semester. There is one small link, but if time permits, I'll mention that later. We see that the nervous system is going to influence breathing, both when we are doing it voluntarily and also when we are asleep. And we see that whenever you have the sympathetic system being activated and you need to have an increase in the breathing rate, we will see how the nervous system controls that. As far as the muscles are concerned, we'll talk about the muscles which are found in between the ribs. They are called intercostal muscles. We'll also see the role of the diaphragm, which is found at the base of the rib cage, how that can help air to flow in and out of the lungs. And it is the cardiovascular system which is going to bring deoxygenated blood to the lungs, and then the oxygenated blood is taken back to the heart, and from there it goes to the rest of the body. And last but not least, we will see how the immune system can also play a role in the respiratory function. We will talk about an example of the immune cells which are found in the alveoli as well. So I hope I've convinced you that what we discuss in units 1, 2 and 3 are relevant for unit 4. And so if you haven't already been doing it, please do 1 RPA per day, right? Let's say today you study for the exam tonight, but starting tomorrow, do RPA 1, then do RPA 2 the next day, and once you're done with all the RPAs which are available, go back to RPA 1 and keep repeating and practicing with this information. So here's an overview of what I'll be covering today. So today we will see what are the various components of the respiratory system, and the various components can be divided based on their anatomical and their functional division. So the anatomical division is just referring to upper and lower respiratory system, but the functional division will actually tell you what is the function of each of those parts of the respiratory system. And then as we go down the respiratory passageway, we'll see how the types of cells we encounter will be different, right, as you go from the nasal passageway all the way down to the alveoli. So let's start with the big question: what is the respiratory system? So the answer is shown right here. The respiratory system is the network of organs and tissues which help you breathe. So what do we mean by breathing? Breathing is referring to both the air entering into the lungs and leaving the lungs. And another term for the air moving in and out of the lungs is known as ventilation, right? So shown right here, it's called as ventilation. Now this cartoon here is showing you that the air is coming in through the mouth, right, and it goes all the way to the alveoli in the lungs. And by the end of today's lecture, I hope you all can tell me why it is not optimal to breathe through your mouth, right? There may be times when you need to breathe through your mouth, but it's very important to breathe through your nose. So respiration can be divided into two parts: external and internal respiration. And external respiration is referring to the gas exchange which takes place in the alveoli and in the surrounding blood vessels. So external respiration includes the carbon dioxide moving from the bloodstream into the alveoli and the oxygen moving into the bloodstream from the alveoli. Now the reverse of that is the internal respiration. This happens down in the tissues, like in your little toe, and here you have oxygen moving from the bloodstream into the tissues and carbon dioxide moving from the tissues into the bloodstream. So the question is why, right? Why is our body requiring oxygen, and why is it producing carbon dioxide? And the answer to why carbon dioxide is being produced and oxygen is being used can be explained by cellular respiration. So this is an equation you must all be very familiar with. We talked about it in lecture 4 when we talked about metabolism, and this is showing you what happens in carbohydrate metabolism. Oxygen is used and carbon dioxide is produced and water is released during the breakdown of glucose. So this simple equation, we looked at it in greater detail as shown in this panel here. There are just a couple of things I want to point out from this lower panel though. Notice that oxygen is being used in the final step of the electron transport chain, where it can accept electrons and form water, right? That's why we need oxygen. And the carbon dioxide, it's going to be produced at a couple of different steps. Mainly it's produced in the citric acid cycle or the Krebs cycle or the TCA cycle. That's where you have carbon dioxide mostly produced, but also the conversion of pyruvate to acetyl-CoA also produces carbon dioxide, right? And so we see that all of the carbon atoms in an initial glucose molecule will be eventually converted into carbon dioxide, right? So again, this is just a recap of what we know previously. And when we think about the various parts of the respiratory system, we will consider the airways and also the lungs and the blood vessels as well. So in today's lecture, we are going to spend most of our time talking about the airway passage in the respiratory system, and we'll briefly touch upon the role of the blood vessels as well. However, the function of the lungs is something we will discuss tomorrow and later this week, right? So this is what the respiratory system does, and now let's consider what are the various components of the respiratory system. So as we consider the various components of the respiratory system, we can see that the anatomical division will divide it into the upper and the lower respiratory system. So this division of upper and lower seems to be quite arbitrary, right? To say from this point onwards it's lower, from this point onwards it's upper. But let me tell you how you can keep the division between these two clear in your minds. So in the upper respiratory system, it's going to start with the nose, right? And the nose is holding the nasal cavity, the cavity inside the nose, and that's going to lead on to the pharynx. Now notice that the paranasal sinuses are not shown in this picture. This is right here, but it makes more sense to see the paranasal sinuses in a frontal section or a coronal section of the skull. So I will show you what that looks like in the upcoming slides. And with that, we can move on to the lower respiratory system. Now the lower respiratory system starts with the larynx, and then it moves on down to the trachea or the windpipe, and then that gives rise to the bronchi, which will enter each of the lungs, and that will keep further branching into bronchioles, and it eventually leads to these respiratory bronchioles, which gives rise to the alveoli. So it's very convenient for us that the word lower starts with the letter L and the word larynx starts with the letter L, and the lower respiratory system starts at the larynx and it's all the way down, right? So the larynx is also known as the voice box in common terms. So this is the anatomical division of the respiratory system. And now let's consider the functional division. So in the functional divisions also you have two types. You have the conduction portion, right? And this conduction portion is going to start at the nose, the nasal cavity, and is going to go all the way down to the larger bronchioles, which are in the lungs. And moving on from the conduction portion, we have the respiratory portion, which is referring to the part labeled here in red. So this is the respiratory bronchioles, which gives rise to the alveoli. So what is the function of the conduction portion versus the respiratory portion. So the conduction portion is just there to help air to enter into the lungs, and it can also help air to leave as well. And in the respiratory portion, that's where you have gas exchange taking place. And the purpose of the conduction portion is to prepare the air so that it can engage in gas exchange. So what we mean by preparing the air could be the filtration of the air which is entering into the lungs, filtration, making the air humid, and making the air warm. So all of those are steps in making sure that the air is ready for gas exchange. Now the significance of these three things besides filtration may not be very apparent, but we will talk about it in more detail. So we see that the gas exchange is going to take place in the respiratory portion, and that's possible because the air has been prepared as it moves through the conduction portion. So now let's look at the respiratory passageway and see what is in its lining, right? So we find that there is what is known as a respiratory mucosa, and this is referring to what lines the conduction portion of the respiratory system. So this picture on the right hand side is a scanning electron micrograph of the epithelium or the cells seen in the respiratory portion, and it kind of looks like a shag carpet, right? So it looks like a very fuzzy carpet, and we'll understand why this is the case in a minute. So the respiratory mucosa, it's got two parts. It's got the epithelium or these epithelial cells lining it, and on these epithelial cells you have a layer of mucus, right? So that is the first part, and underlying the epithelial cells you have a structure known as the lamina propria, and lamina propria is just referring to all of the areolar connective tissue which is supporting the epithelial cells. So again, taking you back to our earlier lecture on connective tissue, the areolar connective tissue is always found deep to the epithelial cells. So let's take a closer look at the epithelial cells in this figure, right? So we see that the cells found here are called ciliated pseudostratified columnar epithelial cells. The name seems long, so let's break it down part by part. So the term ciliated is just referring to the fact that there are these hair-like projections from the cells. That's why it's called ciliated epithelium. Now the term pseudostratified means that it appears to be stratified, but it's not, so it's stratified means there are multiple layers of cells, and it appears to have multiple layers of cells, but there's only a single layer of cells. And the term columnar means the cells are elongated, and that's how these epithelial cells are. So let's go back to this term pseudostratified and understand why does it appear to have many layers but it's only got a single layer of cells. So if you notice this cell here, notice that it's starting from the basal surface and it reaches the apical surface or the lumen, right? Whereas the cells right next to it, it looks like it's not reaching the apical surface. Now the reason is you are looking at a two-dimensional representation of a three-dimensional structure. I repeat, you're looking at a two-dimensional representation of a three-dimensional structure. So if you were to take a few extra slices and go further down, these two cells which don't seem to be reaching the apical surface will eventually reach the apical surface, but maybe the one next to it won't reach the apical surface. So that is the reason why it's called pseudo-stratified columnar epithelial cells. Now another thing you will notice is that there are these mucus cells which are found distributed throughout this epithelia, right? And so these mucus cells will produce mucus. Notice that there are also these mucus glands which are found in the lamina propria, and so we find that there is this thick layer of mucus in this respiratory mucosa. So the cilia, they will move back and forth, right? And it's because of this movement of the cilia that the mucus is going to be moved further up in the respiratory tract. And so let's say you have some particulate matter entering in, it's trapped, and then as it's the mucus is brought up, you can just, it enters your mouth, you spit it out, and you expel it. Right? So we see that the movement of the mucus is possible due to the movement of the cilia. Now there is a term for this known as the mucociliary clearance, and I think it's very well explained in this very short video clip which I'll play. It's only 2 minutes long. They'll say 20 minutes, don't get scared. We'll watch what is meant by mucociliary clearance.
Mucociliary clearance is an important part of our respiratory defense mechanism. This mucus transport system clears foreign particles and bacteria from the airways. Over the next 20 minutes, we will see in video recorded by Dr. Stanislav Tatkov how this important mechanism is affected by temperature and humidity. But let's begin by reviewing where mucus clearance fits into the human respiratory system. Every day we breathe in more than 15,000 liters of air, enough to fill around 1,600 balloons. Even in the most pristine environments, that air is not clean and pure. We inhale thousands of dust, smoke, and virus particles, about 100 bacteria alone every minute. More than 150,000 contaminants each day that, if given free rein, can infect and clog the respiratory system. These foreign particles, viruses and bacteria, are trapped in an extremely sticky mucus layer lining the airways. Mucus carries the trapped material into the larynx in a process known as mucociliary clearance. The physiology of this clearance process isn't completely understood yet. Research continues, but let's take a close look at what we do know. We know that mucus transport to clear foreign particles is driven by motile cilia. Cilia are small tentacle-like structures with a diameter about 1,000 times smaller than human hair, which beat in an asymmetric rhythm. Cilia protrude from most of the epithelial cells lining the airways, densely carpeting the respiratory tract. This was revealed by scanning electron microscope images. Size is indicated by this scale. The cilia are bathed in a watery fluid. The mucus layer, which traps debris, floats on top of this periciliary fluid, and as the cilia beat synchronously, the mucus layer moves, carrying along trapped particles. Now, the exact mechanism by which the cilia cause the mucus to move remains unclear, and it's the subject of intense research. This particular animation is based on the work of Gaber and Brown.
All right, great. So I hope you understand what we mean by mucociliary clearance. Right now, the term mucociliary clearance is also referred to as the mucociliary escalator effect, because the mucus is being moved up. If you are working in a team and there's a problem and you escalate the issue, you're sending it higher up the chain, right? So the term escalator means things are being moved upward. So this mucociliary escalator function is going to be affected during a condition known as cystic fibrosis. Now, cystic fibrosis, it's the mechanism of the disease is pretty complex, but I just want to explain in a simplified manner just a couple of things. So if you notice this figure here, there are these channels known as CFTR channels, and the purpose of these channels is to help in the transport of chloride ions. So in this panel to the left, we notice that it's a normal CFTR channel, and as a result, chloride ions can pass through, and it's shown here in green. And the sodium ions will follow the chloride ions, and water will follow the sodium ions, and so there will be water leaving the cell as well. But in the case of cystic fibrosis, there could be mutations to these channels, and so the chloride ions cannot leave the cell, and so the sodium ions remain, and eventually the water remains too, and as a result the mucus which is found outside these epithelial cells will start getting very viscous, right? And so as the mucus producing cells produce more viscous mucus, it's going to become very sticky, and that can block the respiratory passageway. So this can also affect other parts of the body like the digestive system, but as far as the respiratory system is concerned, if the mucus is sticky and the mucociliary clearance can happen, then the pathogens which are trapped in, they can lead to infections, right? So this is why cystic fibrosis can be so dangerous. So with that, let's briefly talk about the various types of epithelial cells which we will encounter in the respiratory tract. So the first type is the pseudostratified ciliated columnar epithelial cells, right? And they are found with a number of mucus cells, and we find that these cells will be found in the nasal cavity and in the superior or in the upper portion of the pharynx. Let's stop there, right? So it makes sense that you have this type of epithelia in the nose and the upper part of the pharynx, because you want to trap as much particulate matter as is entering into the respiratory passageway. That's why you have these cells. But then we see that there's going to be a break in the presence of these kinds of cells, and it will continue in the lower respiratory system. And so the question is, why is there a break, right? Why can't we have this ciliated pseudostratified epithelia throughout the respiratory tract? Well, we find that the inferior portion of the pharynx is going to be shared by the digestive system and the respiratory system, and so that is why you need to have stratified squamous epithelial cells which offer protective function, because if you were to drink something hot or acidic, that can affect the lower part of the pharynx. That's why you have stratified squamous epithelial cells in the lower part of the pharynx. And then as you go down the trachea, you'll again go back to the pseudostratified ciliated epithelia, and when you enter the smaller bronchioles, the cells become more cuboidal in shape, and the cilia is more scant. You don't have as much cilia. And finally, when we reach the alveoli, you have simple squamous epithelium, which is just a single layer of cells which will help with maximum exchange of gases, right? So this is just an overview of the various cells we'll encounter, and we will revisit these cells when we talk about the different parts of the respiratory system. So let's start with the nose, right? So the nose is going to be the primary passageway for air to enter into the respiratory tract, and the space which is contained within the nose is known as the nasal vestibule, right? And we find that this nasal vestibule is going to have epithelia which will have coarse hair across the nostrils, right? So this nose hair increases as you age, and people are very particular about getting rid of it because of the aesthetic importance, right? But we find that this nose hair can trap large airborne particles, saw, dust, and even sometimes insects can be trapped from entering the respiratory passageway. And this nasal cavity, it's got a very irregular bony structure, which I mentioned previously, right? And here is a picture of what it looks like, right? So this is a frontal section of the skull, and notice how the bony surface is super irregular, kind of looks like a mask, right? When you look at this cross-sectional view. And as air is flowing through this irregular bony surface, the airflow is going to be very turbulent. So think about water flowing through a tube. It will be very smooth, but then if you look at water flowing over rocks, let's say in a stream, it's going to be pretty turbulent. Now this turbulence of the air currents is very important for a few reasons. So firstly, as this air is swirling in the nasal cavity, it's going to spend more time in your nasal cavity, and the more time it spends there, all the particulate matter can be trapped in the mucus substances lining the nasal cavity. So that's why it's important to increase the time the air spends in the nasal cavity. And we also find that the longer it spends there, the air can become more warm, and it can also become more humid. So how exactly the air gets warm and humid, we will consider in the upcoming slides. But also we find that the circular air currents, they're going to help carry the olfactory stimuli. Let's say, for example, you're smelling coffee. There are around 600 compounds, right, in coffee, which gives its aromatic flavor. So the longer they spend time in your nasal cavity, the signals can be sent to the brain. So let's take a close look at how this happens. So the olfactory region is going to be found superior to the nasal cavity, so it's found further up, and it's got this region known as the olfactory epithelium, right? And these olfactory epithelium are cells which have specific types of receptors, right? And once these receptors are bound by the molecules which are in the odorant, it will activate these nerves in the which are innervating the olfactory epithelium, and that will send signals eventually to the central nervous system. Now a brief note about the olfactory perception. This is something we really don't understand much about. There's still a lot of research being done. We can recognize around 1 trillion smells, but to recognize 1 trillion smells you would need more than one lifetime, right? So in the lab they found around 10,000 smells can be recognized by humans. But just because you can recognize something doesn't mean you can explain it, right? For example, we recognize faces of loved ones. I can recognize many of your faces, but if you tell me to describe it, I can't. And similarly, the sense of smell also, you can say something smells like a banana, right? But that's all you can, that's how far you can get. You really can't explain what you're smelling. Anyway, so moving on to the significance of nasal respiration. So we find that in the nasal cavity you have a lot of blood vessels, right, which are found in the surrounding tissue. And I've just shown this picture to highlight that there's a lot of vascularization, but you don't need to know the names of these blood vessels. Just know what is the purpose of this vascularization. So this vascularization is what helps the air to become both humid and warm, right? And as the air enters in, it gets humid and warm, and as it's going to leave your nasal passageway, it's going to be dehumidified and the heat is going to be reabsorbed as well. So let's see how this happens. So let's say cold dry air is going to pass into the nasal cavity. The epithelium is going to be quite warm, right, because of all these blood vessels, and that's going to radiate heat, and that heat will make the water in the mucus to evaporate, and that water is going to both saturate the incoming air with water vapor, and it will also make sure that the air is going to be heated to near body temperature, right? And both heating up the incoming air and making it humid is very important, because that's how the more delicate respiratory structures which are found in the lower part of the respiratory system can be protected. If the cold air comes in, it can dry out the inner structures, and it can also cause them to be damaged. So if a person were to breathe through their mouth, all of these above mentioned processes will be eliminated, right? You will get air in, but there's no guarantee that it's going to be humid or warm, right? So that's why it's important to breathe, and also the filtration aspect will also be not possible as the air enters through your mouth. So now we can move on from the nasal passage down to the pharynx. So the pharynx, or the throat, is the structure which is shared both by the digestive and the respiratory systems, as I mentioned previously, And the pharynx can be divided into three parts. Right? You have the nasopharynx, which is continuous with the nasal cavity, and then the oropharynx, which is continuous with the oral cavity, and then the laryngopharynx, which will eventually lead to the larynx or the voice box. So there are a couple of other things I want to highlight in this figure. So this bony structure here is the hard palate, and below that you find the oral cavity, and there's the tongue. So you can feel the hard palate if you take your tongue and touch the roof of your mouth, and if it feels hard, that's the hard palate. Now gradually move your tongue backwards and you will reach the soft palate, right? And so the significance of the soft palate is that this will mark the boundary between the nasopharynx and the oropharynx. And if you were to do a histological section of the nasopharynx versus the oropharynx, you will find different types of epithelial cells here. And as I mentioned previously, the pseudostratified ciliated columnar epithelium will be found in the nasopharynx because you want it to trap the incoming particulate matter, whereas the oropharynx and the laryngopharynx, because it is shared by the digestive system, you want to protect those regions from the food and the abrasions which can happen to that part because of the ingested food and drink. So is this clear why you have different types of epithelial cells in the nasopharynx versus the oropharynx and the laryngopharynx? Does it make sense, folks? All right, great. So now we moved on from the pharynx to the larynx, and this is also known as the voice box. So the larynx is this cartilaginous tube, and when we think about the different types of cartilage, cartilage mainly has a protective function, and so the cartilage in the larynx is meant to protect what is known as the glottis, right? So the glottis is shown in this picture here. So this is just the opening between the vocal cords. So these two white lines here, they are going to depict the vocal cords, and the opening in between the vocal cords is the glottis, and here's what it looks like when the vocal cords are closed. And all the inhaled air, it's going to move through the glottis down into the trachea, and so this part is very sensitive, and so it should be protected by this cartilaginous rings. Now there are three cartilaginous structures I want to point out to you in the larynx. The first one is the epiglottis, which is made up of elastic cartilage. And do you know an example of another structure which is made up of elastic cartilage? I can see a lot of them here. What else is made of? Yes, your external ear. Thank you. That's made of elastic cartilage as well. And we'll see what is the function of the epiglottis. And this figure is just showing you what the epiglottis looks like in these two panels. And as we move below from the epiglottis, we find that there is this thyroid cartilage and the cricoid cartilage, both of which are made up of hyaline cartilage. And hyaline cartilage is very rigid. In fact, it's found at the ends of long bones, so this is offering quite a bit of mechanical support and protection. So just to refresh your memories, we talked about different types of connective tissue, and here are the three types of cartilage, and another plug for working on RPAs from the previous units. All right, so moving on, now let's talk about the function of the epiglottis. Now the epiglottis is also known as the guardian of the airways. I always need to look at this, or else I will say galaxy. So it's the guardian of the airways, and what it does is this animation explains it pretty clearly. So this structure here is the epiglottis, and notice how it is going to bend over the glottis, right? So this heart-shaped structure is the glottis, and as it bends over the glottis while you're swallowing a bolus of food, notice that the bolus is going to be directed into the esophagus. Now if the epiglottis did not do that, the food would come in touch with the glottis, and that can trigger the gag reflex. So if food or water touches the glottis, that will trigger the gag reflex. However, this gag reflex is not functional when you're unconscious, and that's why procedures like intubation can be done when you're unconscious. Okay, so we move from the epiglottis down to the thyroid cartilage, and this thyroid cartilage can have this laryngeal prominence, which is also referred to as the Adam's apple in common vocabulary. Right, and this is caused because of the angle caused by this thyroid cartilage, and this thyroid cartilage is going to elongate during puberty in response to androgens. So as the androgen hormones levels go up, it's going to cause this structure to elongate, and that leads to the secondary sex characteristics of having deeper voices in males, whereas in children it's quite short and slender, and it can lead to a high-pitched voice. So this is what it looks like. And if a person is not happy with the shape of their larynx, they can always do this surgery called the chondrolaryngoplasty to reduce its size as well. So now let's talk about the functions of the larynx. So as the common term indicates, it's called a voice box. So this is very important for speech production. And the major function, it's going to provide this patent airway. What we mean by patent airway means it's going to keep it clear and open, and any sort of injury to the neck or trauma can make the larynx to be compromised. A second function is the switching mechanism, which I mentioned previously. So this shows you how the epiglottis is going to bend over the glottis and ensure that food can enter the esophagus, but when you're not eating, then it can make sure that the air is entering into the windpipe. And I also said that if there is liquids or solids coming in touch with the glottis, that can trigger the gag reflex. And we also find that the vocal cords, which are found on either side of the glottis, can help in sound production as well, right? So I think rather than explaining how sound is produced by the vocal cords, I want to show you a short clip about this, right? So what they're doing here is a stroboscopic examination, where they're going to, when you think about strobe lights, they're just flashing lights, right? So similarly, they're having flashing lights shine down the larynx, and so you can see the vocal cords vibrate.
Here is a look at some normal young female vocal cords during a stroboscopic exam.
See how the vibration changes as the sound changes. Alright, then if you want to continue watching the video clip, I've given you the link. You'll see how it changes, actually goes from lower to high notes and high to low notes, right? So all to say that the air passing through the glottis is going to vibrate the vocal folds, and that's what is producing the sound waves, right? Rather than just reading out the sentence to you, I think the video clip did a great job. So when it comes to speech production, the air leaving the glottis is going to come out at an intermittent manner, right? So it's going to be the opening and closing of the glottis will bring out air in an intermittent manner, and that's what leads to speech. And the loudness is going to be dependent on the force with which the air is moving through the glottis. So if it's moving at a greater force, the volume goes up. At a lower force, the volume drops. Now the pitch can also be changed by the tension of the vocal cords, and what affects the tension of the vocal cords are voluntary muscles, and that's why vocal exercises are really helpful, right? And personal example, I found that when I was doing any trumpet players here? Brass instrument players? All right. I was doing I see you. I was doing the long notes on the trumpet, right? And I found that it improved my singing range as well. right? So vocal exercises do help. And as the sound, the airwaves are moving through the pharynx into the larynx, from the larynx into the pharynx will resonate, amplify, and it can enhance sound quality. And the sound will be shaped by your lips, the position of your teeth, and the tongue, and so on, right? So if you were to just maybe stick your lips inward, that'll just change how you sound. That's how voice actors can get a whole range of voices, right? And on Sunday, I actually was talking to a family friend, and he mentioned that when he heard me speak, and he wasn't watching, he thought it was my dad, right? So we see how genetics can ensure that there's similarities, right? And each of us have very different larynxes. That's why we all have different kinds of voices as well. So we'll move down from the larynx down to the trachea. It's also known as the windpipe, and we see that it's going to bifurcate and branch into the left and the right bronchi, and it will enter into the two lungs. Now the point where it branches off, it's called as carina, because it looks like the keel of the ship. That's what the early anatomists were reminded of when they saw the bifurcation of the bronchi. Now another thing to note here is that there are a lot of these tracheal cartilages you see throughout. So you have around these 20 C-shaped rings, right? And so this C shape is evident when you look at a cross section. So this cartilage here, it's also hyaline cartilage, and we see that it has a protective function, and it's going to keep the airway open, right? But we see that there's this one point where it is discontinuous, and the place where this tracheal cartilage is discontinuous is where it is going to be found alongside the esophagus. And imagine if it wasn't continuous. Every time you try to swallow food, it's going to be restricted by this tracheal cartilage. But having this C shape of this tracheal cartilage allows the esophagus to distend as the food goes through, and then it's not going to be impaired in its distension and relaxation. Now this C-shaped region, it's going to be supported by two structures. One of it is the annular ligament, and which is made up of connective tissue, and there's this muscle known as the trachealis muscle. Now the significance of the trachealis muscle is that it is a smooth muscle which is controlled by the autonomic nervous system. So whenever you have the fight or flight response and you have the sympathetic stimulation, it is this muscle which relaxes, and that ensures that more air can be delivered to the lungs. Remember talking about the fight or flight response, the nervous system? This is how it affects the respiratory passageway. So now let's take a close look at the respiratory epithelium, right? And so now when we're back in the windpipe, you again have this pseudostratified ciliated columnar epithelium, because it wants to trap any particulate matter which is entering into the windpipe. And so this resembles the epithelia found in the nasal cavity and in the nasopharynx, structures which are in the upper part of the respiratory system. And notice that there are these glands found deeper to these epithelia, and that will help produce the mucus which will trap any particulate matter. So I'm going to stop here, and we'll pick up with the bronchial tree tomorrow. I wish you all the best for the exam tonight, and I'll see you back tomorrow. Thank you.